Imagine an operating room. That intense environment where every single second truly counts. Decisions happen in an instant. Precision is absolutely critical. But for a long time, this high-stakes setting has often been, bogged down by different technologies that don't talk to each other, data scattered everywhere, and manual processes that, frankly, add delays and even risk. So today we're doing a deep dive into OR integration systems. We're focusing specifically on one advanced solution called CureVision.
That's right. And our mission here, drawing from industry reports, hospital case studies, and CureVision's own technical details, is really to get a handle on how these systems create a seamless, data-driven surgical environment. We want to explore how they help surgeons, anesthesiologists, or staff, basically everyone, focus purely on the patient. How? By streamlining workflows, boosting collaboration, and importantly, enabling smarter decisions. And we'll touch on who really benefits, hospitals, surgical centers, the surgeons themselves, specialists or management teams, even healthcare risk professionals. It's a wide net.
Okay, so we're really unpacking how something like CureVision fits into the very core of surgery. Not just what it does, but, why it actually matters. Okay, let's get into it. Let's kick things off with what's often been a major headache in ORs. That patchwork of different disconnected systems. Think about it, one screen for vitals, another for imaging, maybe another for the surgical tools themselves. It's like trying to fly a plane with a dozen different unrelated dashboards. So how does a system like CureVision actually tackle this fundamental fragmentation problem?
Well, it really hits it head on by centralizing and automating a lot of those separate processes. The key idea is creating a kind of unified command center. Imagine just one single dashboard. It's intuitive and it pulls in everything, real-time patient vitals, high-res images, even how the surgical devices are performing. All that critical info instantly available right there.
On one screen.
Right. On one screen, yeah, exactly. And it's not just about seeing the data, it's also about automation. It automates routine things, the sort of tedious admin tasks. So we're talking about integrating pre-surgical checklists, automatically checking if devices are ready, even handling the data archiving after the operation. That takes a huge load off the staff. And maybe even more critically, it helps cut down on errors using real-time alerts. So if a patient's vitals change suddenly or a device isn't working right, the system flags it immediately.
So the team can jump on it proactively.
Precisely, before a potential issue becomes a real problem.
That alert system sounds like it could be a genuine game changer for patient safety. And, to give you a concrete sense of the impact, there was this case study I saw presented at a big cardiology conference. A cardiac surgery team used CureVision, this unified interface, to watch vitals and adjust devices in real time. They reported cutting their prep time for complex cases by 25%. That's significant. What specific bottlenecks do you reckon they cleared up to get that kind of efficiency boost?
That's a great question. Typically, those kinds of gains, they come from getting rid of the need to manually type in data or cross-check info between different screens. When it's all consolidated, the team just spends less time hunting for information and more time focused on the patient, on the plan.
Yeah.
And those automated checks you mentioned, like device readiness, that used to be manual verification documentation, just eats up valuable prep time.
Makes sense. So beyond just making things faster, the success of any OR, especially complex ones, really hangs on perfect communication, doesn't it? And I don't just mean people talking in the room, but connecting with specialists elsewhere, maybe even remote locations. How does CureVision help with that vital communication piece?
You've nailed a really critical point there. Communication breakdowns. They can have really serious consequences in surgery. CureVision helps bridge those gaps by enabling really robust, real-time collaboration. One of the standout features is its live telepresence capability. And this isn't just like a basic video call. It integrates high-res, low-latency video and audio straight from the surgical field. So surgeons can consult remote specialists right in the middle of surgery.
Wow, so they can get instant feedback.
Instant feedback, expert guidance exactly when it's needed most. The remote expert sees precisely what the surgeon is seeing. And it's also powerful for coordinating within the hospital itself. Data gets synced across the whole team. Anesthesiologists, nurses, assistants, keeping everyone totally aligned on the patient's status and how the surgery is progressing. And thinking bigger picture, this tech also opens up huge training opportunities. You can live stream surgeries for junior doctors, students, specialists anywhere in the world.
So they can observe and learn safely.
Exactly. Observe, refine skills in a realistic setting without actually being invasive.
That telepresence, especially the high-res, low-latency part you mentioned, sounds incredibly powerful. I actually remember reading about a specific case in a neurosurgery report. A team used CureVision's Telepresence to consult a remote expert during a really tricky spinal procedure. And that direct, real-time consult, it was credited with helping improve precision and leading to a faster recovery for the patient. So when everyone's on the same page and you can pull in expertise from anywhere, what's the bottom line for patient care?
Well, but the bottom line is higher quality care, definitely reduced risk, and often more predictable, better outcomes. When communication flows smoothly, the team just operates like a single unit. Those errors from miscommunication, they drop dramatically. And expertise, which might be, miles away, can effectively be brought right to the patient's side. That enhances safety and efficiency.
Okay, so in these high-pressure surgical moments, every decision counts. It needs to be fast. It needs to be right. How does CureVision specifically help sharpen that clinical judgment? How does it empower smarter, more data-driven decisions for the whole team?
It does that by delivering what you could call truly actionable insights. It's pulling together all that data, the real-time vitals, the imaging, the surgical parameters. CureVision isn't just hoarding data. It's presenting it so the team can make informed choices right then and there instead of, digging through different systems. And an interesting development here is the move towards predictive analytics. It's still evolving, sure, but future AI tools are being designed to look at historical data, real-time data.
To sort of predict problems.
Yeah, exactly. To anticipate potential complications, maybe suggest better strategies, and just proactively boost patient safety. It involves complex algorithms, lots of validation, obviously, but the potential is huge. And from a hospital's operational view, a really key thing, something that often stands out, is that CureVision is built to be vendor neutral.
Vendor neutral? What does that mean in practice?
It means it's designed to work smoothly with pretty much all major OR technologies, regardless of who made them. For hospitals, that's massive. It cuts down on compatibility headaches, avoids getting locked into one specific vendor for everything, and makes the learning curve easier for staff already used to certain equipment.
Right. That vendor neutral part sounds critical. For anyone less familiar with all the tech in an OR, why is that such a big deal? What problems does it help hospitals dodge?
Oh, it's absolutely crucial because, an OR is like a mosaic of equipment from dozens of different manufacturers. Anesthesia machines, imaging gear, surgical robots, you name it. Now, if your integration system only plays nice with one brand, you're stuck. Either you face a really expensive overhaul of all your equipment, or you just live with fragmented data, which defeats the purpose. Vendor neutrality lets hospitals use the equipment they already have, their existing investments, while still getting the benefits of integration. It avoids massive spending and those super complex custom IT projects that can take forever.
That makes total sense. And to give another powerful example, there was this report about a complex trauma case. The surgical team said CureVision gave them instant imaging updates, device calibration info, and that allowed them to make life-saving adjustments in literally seconds. It just underscores the need for speed and accuracy. But how does this all weave into the day-to-day? Let's walk through. What does a typical surgical journey look like, say, from prep to recovery, when CureVision's fully in place?
Right, it really does transform the whole flow. Okay, so pre-procedure. The team reviews everything, patient history, current vitals, imaging, all on that central dashboard. Device readiness, checked automatically, no running around. All the equipment is confirmed ready. They can even do a virtual pre-surgical briefing, get all the different teams aligned, even if they're not physically together, before anyone even steps into the OR.
Okay, so everyone's prepped and aligned. Then what happens during the actual surgery?
During surgery, the surgeon's monitoring vitals, adjusting equipment, pulling up imaging again, all through that single interface, very streamlined. If things get complicated or they need a second opinion, they can initiate that teleconsultation with an outside expert for a live guidance. Meanwhile, the anesthesiologists, the nurses, they're getting those real-time alerts if the patient's condition changes significantly. So the response is fast and coordinated.
And after the surgery?
Post-surgery, all the data from the procedure, every setting, every vital sign reading gets automatically archived. Creates comprehensive documentation, and that data gets integrated right into the patient's electronic health record, which makes follow-up care much smoother. Plus, and this is important for improvement, the team can actually review performance metrics from the surgery. What went well? What could be better? It helps standardize best practices across the hospital.
It really sounds like a massive jump in both efficiency and coordination. So looking beyond just the features, the practical stuff, what are the bigger benefits? Why would healthcare teams come to trust a system like CureVision? What's the experience like for the staff? Are there less obvious advantages?
I think what really resonates is the impact on the human element in the OR. First off, it genuinely reduces operational stress, automating workflows, centralizing data. It minimizes that administrative burden, that frantic searching for information. This lets surgeons and staff actually focus on the patient, on the procedure itself, instead of wrestling with the technology.
Less tech juggling, more patient focus.
Exactly. Second, it profoundly improves communication. Those collaboration tools mean everyone's aligned. It drastically cuts down miscommunication in what's already a high-stress place. Think of it like everyone having the same perfectly synced playbook in real time. And third, and obviously most critical, it directly helps boost patient outcomes. Real-time data, the potential for those predictive insights we talked about, better workflow efficiency. Systems like CureVision empower teams to deliver safer, faster, and more precise surgeries. Now, it's fair to say, switching to systems like this isn't trivial, right?
Yeah, there must be challenges.
Oh, yeah. It needs significant training, a real commitment to changing how things are done in the OR, a cultural shift almost, and of course, a substantial upfront investment in the tech and infrastructure. But the argument is the long-term gains really do outweigh those initial hurdles for many institutions.
It seems clear then that systems like CureVision, these integrated platforms, they aren't just about tweaking workflows. They're fundamentally about creating an environment that's more efficient, yes, but also more collaborative and ultimately safer for everyone involved, especially the patient. It really feels like an emphasis on lifting the whole standard of care.
Absolutely. And, that brings us to a final thought, something provocative perhaps for you listening to consider. With medical innovation speeding up so fast and the demands on healthcare systems just constantly growing, how might these deeply integrated systems like CureVision do more than just improve outcomes for individual patients? How could they potentially reshape the future of medical training or even global healthcare accessibility? What stands out to you as the biggest potential impact down the road?